And if this will be recorded, as Adam mentioned, you see the little blinking light indicating we're recording this. This will be uploaded to YouTube. And Adam just posted the agenda. So we do have what I think will be a full agenda, but you never know. We've got the telework updates. Adam's going to take point on that. We've got the classification committee outcomes. Adam will talk mostly, I think, about that. I'll have a lot to say about telework as well. We have the third representative. I'll take point on that one. AMA, MA timelines. I'll update everybody on that as well as it works its way through the board. DFCS reorg conclusions. I know some of you had put in some specific requests. I'll talk on that. This is really winding down. And then, of course, the real team SSA DFCS discussion. Some of you may know this as the GARE project, but it's pertaining to real team and both some benefits and concerns that have been raised concerning that.
Yeah, well, why don't we get started with the telework discussion then? And as we have a fairly small group today, everyone's got the ability to unmute themselves. So if you have a question, please feel free to unmute and jump in, or you can put something in chat. But as always, it's easier if you're going to type in the chat to not send it directly to myself or Zeb, as we sometimes miss things then. So telework, folks will have seen the update come out last week that SEMA did concur with the county's updated telework policy. So last thing folks would have heard us talk about this was kind of our analysis of the pros and cons of the new telework policy. And those were, you know, the major pro is that our previous telework language required ESA to approve telework prior to being implemented for every individual telework application. And folks will recall, you know, pre-COVID, things would often sit there for 3, 4, 5 months before getting approved. That was a major downside. The new telework policy eliminates that. We had an initial draft of the policy from ESA about, a month and a half back, maybe 2 months back. That was significantly more voluminous with more forms than even the final version had. SEMA eBoard and Zeb did some work on, you know, crafting a response to that. A lot of those changes were incorporated into the policy that's now in effect. It was trimmed down. Some of the redundancy was removed. And then there were a couple final points that were keeping us from concurring until kind of the very end. And I understand particularly in SSA, over the last 2 weeks, there was some confusing messaging going to the SSA leadership that all unions had already concurred with the policy and that it was being sent out and was in effect. At the same time, department leaders or members were hearing from us that, you know, hey, be aware SEMA has not yet concurred with this. We have now, and those final issues that were resolved were, there was a part we particularly didn't like that said individual departments can make addendums to the policy without consulting SEMA. And from our perspective, we don't want to be in a position where we're trading specific bargain to contract language that we have around telework for something that has the ability to be infinitely changed without our input, you know, possibly in detrimental ways. I don't think that would be a likely eventuality, but it's a possible one and something that made us reluctant to concur with the new policy. So we were able to get that issue addressed, and that any addendums will now have to come through SEMA before they're incorporated into the policy. So with that and a couple other final changes, we gave our concurrence on that policy. So we are now on, you know, the general kind of countywide telework policy. There were some FAQs that were sent out as well with that telework policy, and some of the major questions that we've gotten from around the county, and SSA included, have been issues where when members put in, you know, their telework applications, telework requests, it'll go to kind of that frontline, you know, director, manager sometimes, and it'll come back with a denial, then saying, you know, the county policy does not allow full-time telework, or it requires you to be in the office at least 1 day every week, or it requires, you know, the county's just not approving any of these right now, have been some of the things we've heard back. So all those points were addressed in the FAQs were sent out. The important thing to know about the policy is that it basically gives complete discretion to the department on telework approval and denial, right? That means departments can approve full-time telework, you know, 10 days of pay period, if that's something that works for them, They're also in a position to not approve telework. That what we've said, I think it, previous SSA site meetings and continues to be our practice, is that where there are departments that did telework successfully during, the last year, during lockdown, during COVID, where telework was successful, if now that folks return to the office, the department is approving people for the same or less telework overall than there was pre-pandemic, pre-COVID, those are areas where we want to get involved. And most of the areas where we have gotten involved, I obviously haven't been involved in any at SSA. Maybe Zeb might be able to speak to some. We've had a handful at the hospital, for example, in the last 2 weeks, where individual departments have said, no, we're bringing everyone back. We're going to be back 100% in the office full time, even though we had, successful telework during the pandemic. But then more frustratingly, pointing the finger kind of up the chain of command towards executives over HHS, saying this is the expectation that's been set for us. And then, we escalate up there because by and large, executives around the county are on the same position on this, which is they're pushing the decisions down to the departmental level as the policy instructs. So one, they don't want to be blamed for a department, making a decision that's theirs to make. And two, I would say most county executives have been reasonably supportive of telework. So we've been able to intervene in those areas and get, 2-3 days a week telework approved for folks in those situations. But those are the areas that we want to be involved. If at the departmental level, we're seeing the same or less telework than pre-COVID, and it was reasonably successful during the pandemic, those are situations where please do reach out to myself or Zeb. The forms for the application have been sent out. They're also on the county intranet now. It's the same 5 forms that everyone else is going to be filling out. And those are sent to your direct supervisor or manager, depending on whatever the first person above you is. And it's their obligation to review and approve them. The last thing I would say on this is something that's kind of come up, and this will overlap a little bit with the Delta variant conversation I saw Zeb posted in chat. I think we're definitely aware, and members are aware, that this, return to work on one hand is continuing apace, per the schedule that was set 2 months ago, 3 months ago, when this date was decided. And frankly, we're in a somewhat different position with regards to public health and where we would have hoped we would have been 2 months ago, right? And that's because case counts are rising. Last I heard, I think 50% of the new COVID positive cases in Santa Clara are coming from people who have already been vaccinated. Thankfully the hospitalizations aren't rising apace, and deaths obviously aren't rising apace. But this hasn't caused any pause as of yet with the return to work, deadline that the county set for their departments. You'll see a survey come out from SEMA likely later this week with some questions on this topic. We're trying to think about ways we can possibly address this, because of the kind of what ended up being a very quick turnaround on getting everyone back in the office and getting a new policy in place. The county obviously didn't take the time to go through, department by department, classification by classification, and see how can we really maximize telework in each area. And that's something that we might be able to, re-raise now, given where we're at public health. We're at a mask recommendation. The CDC's now adopted. Unfortunately, it feels, at least to me, like we're on a bit of a treadmill there towards increasing levels of restriction and lockdown. So this will be an opportunity for us to not likely change the policy that we've just concurred with, but given that the policy does allow for up to full-time telework, to try and address how can we ensure that departments are really maximizing telework wherever possible. Zeb, anything you want to add on that, and any questions from folks?
Sure. So I want to give ample time for questions. I know that, we'll take them as they come in. I know that in the past, when we've talked about telework, we've had a lot of different questions. I think some of that is settling down. SSA has been pretty good. I know this is anyone's welcome at this meeting. This is primarily focused on SSA, though. Has been pretty good about emphasizing telework, as Adam points out, which is different from some departments. Some departments are saying really exceptions will be made, or they will say, we're just not entertaining telework. A good example of that is the assessor's office, or a good example of that is 911 county comm. 911 County Com for very operational, clear reasons. They can't, they're choosing not to, which I would have a hard time arguing with from an operational perspective. In a department like the assessors, it's a very political decision. It's not very tied to operations. So in those circumstances where it's political, where SEMA can push back as an institution, we're really looking to. So please do alert us to that, where you think that's a significant issue, that you have a classification or a particular role that ought to be on telework, but for reasons they are not, that are unrelated to the business operations. Also, with regards to the Delta variant, this is something that in fact, we had a public employee meeting with our brothers and sisters at Operating Engineers this morning. We were talking to the political director and so forth. So there are a couple of things that have occurred since our last site meetings and discussions with membership. One is some of you may know, maybe you don't. Dr. Smith did an interview where he said that his plan is to mandate vaccines for all county employees. He also said in the same breath that he would be meeting and conferring with all the unions to do that. Labor Relations has not yet reached out to us about that topic, but we can anticipate it's coming if he's publicly announcing this. As a reminder as well, the board is coming back into session in August. So that's likely when policy decisions are going to be made about this issue. And when I say this issue, I mean mandatory vaccinations in general for employees, and also what the organized response to the Delta variant and rising case counts, again, for COVID are going to be. Also, I wanted, for those that are really looking at the politics of this, Governor Newsom issued a Cal HR directive, and this is something I learned from our staff meeting today when we were talking with our political director, a gentleman named Chris Snyder, and then our lobbyist in Sacramento, Tim Kremens. I did not appreciate this difference before. So apologies to you all. If you all caught it, you're smarter than I am in this regards. So I thought that the governor had issued an executive order. It turns out he didn't. He issued a directive to the California HR department and said, state workers, get your vaccines. That's going to be a mandate. And then PS, other employers were recommending you get a vaccine. That's very different than mandating vaccines through an executive order, which I mistakenly thought he did. We hadn't taken any action on that yet, but I thought that he had actually ordered that last week. So it turns out he didn't. It's an indicator of the direction the state government is going in, but it's far short of giving authorization to local employers to just require.
And for folks, I'm sure most people were asked to sign a petition at some point coming out of their local grocery store on the recall. We'll know that, what were framed as, I think, unconstitutional executive orders were kind of one of the big points for Governor Newsom's recall. So possibly a reason for him to take kind of this softer approach rather than re-raise those issues in the midst of the recall. But we're seeing kind of a similar analogy play out in nearby counties. There's a couple different ways that Santa Clara can approach this. What we've seen at Alameda County, for example, is that for their healthcare workers, what they've sent out to their labor unions there has been notice that they are going to either require every healthcare worker is vaccinated, or they're going to be testing you between 2 to 3 times per week, and that you have to test negative, obviously, each of those tests. And from that stance, they're taking the position that does not meet the threshold for meet and confer. So they're just implementing it. Since they're framing this as a choice that individual employees have, we're not technically requiring you to get vaccinated. We're just saying we're going to test you multiple times per week if you don't. It seems like Dr. Smith may have been, either a little bit out over his skis on this, or maybe the interview wasn't supposed to get posted until a little time later. But ESA, when we reached out, was hadn't even yet read the news article and were unaware that this is something that was being contemplated. So it doesn't seem like there's any definite plan now that they could try and come down with an actual strict mandate. That the emergency use authorization, I think it's questionable whether with that in place, they actually have the authority to mandate it the way you're required to have a TB test and your measles and your mumps and everything else when you're a healthcare worker. But they may try to get around it kind of the way other nearby counties have by saying it's an option. The alternative is extremely frequent testing. Regardless, it's good to see that Dr. Smith in that article, like Zeb said, acknowledged that this issue will need to go through individual labor unions for bargaining, as it's an impact on working conditions. So we'll likely have a survey out on this as well to get feedback from folks. The significant majority of SEMA members and county employees overall have been vaccinated, but we'll need to determine what our official response to the county is going to be if and when they approach us on this issue.
Sorry.
That's correct. And also with regards to this issue, the science, it's hard to understand what science to accept or what reports are accurate. It appears to and believe me, I'm trying not to editorialize this at all. And it's hard because there's so many conflicting reports, right? And some muddledness on which agency is requiring what. It appears that the Delta variant is causing a new upsurge in the unvaccinated population of the world. The United States in particular, we're probably concerned with Santa Clara County in this circumstance. However, it also appears clear, and Adam has talked with some of our medical professionals over at VMC, it also appears clear that the Delta variant is punching through the vaccine for those that have been vaccinated. Now, the national data is telling us that although you could get sick from the Delta variant, if you have been vaccinated, it's likely that you will have a very mild reaction. But there are still a few people locally that are being hospitalized, even though they have been vaccinated, due to exposure to the Delta variant. And Adam, you were just talking earlier, I think when we were talking this morning, it might have been last night, I don't remember. There were some, local super spreader events as corporations had come back and welcomed all their people back with no precautions and no masks, and then people got ill with the Delta variant, not necessarily being intubated or dying, right? But still getting ill.
Yeah. So definitely a rapidly evolving situation and something that we want to get member feedback on before SEMA has to take an official stance with the county on it. So something folks will see surveys on this week. And you'll expect questions like, something we're going to want to be able to nail down is to what degree do we have folks in SEMA that would consider, looking to take a job somewhere else if, a vaccine mandate came down, those kind of things. To what degree is that something that the county needs to be considering if they're looking to mandate this? What are the kind of exceptions that we'd be looking for? Women who were, either pregnant or looking to get pregnant, there's not good data yet on, vaccine safety for that population. There's been, concerning studies about, particularly for young men under 22 or so, have more high rates of adverse reactions. Folks maybe who have already had COVID and are positive for antibodies. These are all kind of things that we'll, be able to raise with the county and discuss whenever we're looking at a policy. Does it make sense to, maybe have some level of mandate for folks who interact with the public, but not one for people who never interact with the public? These will all kind of be within the range of what we can raise, and we'll be looking for your input on how SEMA members feel about that range of topics, given that this is all of your guys' workplace, and you one, are going to be subject to this mandate, but two, this is also going to be creating the workplace that folks are going to be working in, right? So everyone has a say in this.
And also, I want to be clear. I don't believe, Mary, you can correct me if I'm wrong, Mary Beth, I don't believe our board has taken a stance on this particular issue of vaccine mandate. In the past, the board has broadly been supportive of getting education out there and encouraging people to be vaccinated. So anecdotally, that's been my experience talking with members. That's been my experience on site meetings, but we want to have some numbers to back that up. Right now, my sense of the unit is SEMA is pro-vaccine, right? We believe the science. We want people to get vaccine. I hope that's not going out on a limb. But if there are people that for good reason can't get the vaccine, they're a Jehovah's Witness or a Christian Scientist, or they've already had the vaccine, or they're allergic to it or whatever, and it's bona fide, right? It's not some of the more incredible arguments against the vaccine that are out there. Then we need to make sure that those workers' rights are safeguarded as well, right? And so if there's something that there's a vaccine mandate, or you have to wear a PPE and be socially distant, or you have to, maybe there's some heightened thing, you have to be tested every week or every 3 days. Okay, great. Then we want to meet and confer on that, and the county pays for that cost or of the test or whatever it is. I was told that it's $199 now. I don't know if that's accurate or not. That's what one member reported it costing. And we want to make sure that those requirements are clear if someone doesn't get the vaccine, and that those costs are not given to the individual. So a lot to think about on that, probably. And then again, we want to have some real numbers so we can say 70% of SEMA members are pro-vaccine. That's very clearly then our institutional policy. Or we understand that the board takes a position that's different than the membership, which occasionally happens, but it's very rare. The board's very responsive to the membership. So it just gives us an opportunity to have a more informed decision.
Zeb, this is Robin. I'm on the call, but I'm on the phone.
Oh, hey, Robin.
Robin.
Okay. Hi, guys.
Good afternoon. Did you want to weigh in on this, Robin? This is another one of your board members. For those of you that don't know, Robin Rivas Romano.
No, I just wanted to make sure that I'm on the call, not just Mary Beth from the board.
Okay, great. Thanks, Robin, and welcome.
Okay.
Well, we can come back to this if folks have questions on it. It seems like a somewhat quiet group today, but we'll be happy to return to this if folks think of questions. The next item we had on here was the classification.
Let me say one last thing on that, Adam. If the county moves to require additional restrictions because of the Delta variant, just know that it's part of SEMA's strategy to use whatever we can to get more telework opportunities. So however that manifests itself, any health concern is a bona fide reason to heighten telework opportunities. So that's going to be in the back of Adam and my mind, mine and Adam's mind at all times. My mind and Adam's mind. You know
Adam's
what I mean.
mind and my mind.
Thank you. Me talk good. Okay. So I'll turn it over to Adam now for information on the classification committee outcomes. Thanks.
Yeah, just to add on a little bit to what Zeb said, I can't speak for the SSA executive leaders. I don't have interaction with them, but at least executives in my area have been, it's very much on their minds, the level of kind of face and trust that county leaders are going to lose if there's been this strong push to get folks back in, in the middle of summer when school's not back in yet, causing folks to kind of uproot their lives, only to end up back on some level of, heightened lockdown restriction. We're required to send folks back home, later this summer or fall. Dr. Smith is very adamant that's not going to happen, as our leaders in health and hospital, that there's a lot of steps in between where we are now and that point in time. I think just from my personal perspective, it does feel like as things are ramping back up, this feels kind of like deja vu, the order of things we had before the last lockdown. Mask recommendation, mask mandate indoors, some level of distancing. So we'll see. But the strong push to get folks vaccinated might be, what they're hoping to help avert the need to go back on some kind of lockdown or send more folks home. And that might be why this has become pressing now. So we'll see. So the classification committee. So this process took longer, I think, than we were hoping after we had the final list identified internally with SEMA. But we finally wrapped the process up with HR to get all of our classification studies in and approved. We're sending out individual emails now to folks to confirm their inclusion. This is going to be the group that submitted through SEMA, had your applications vetted with us, and then we met with HR as the committee, as the contract language outlines, to get the final list agreed upon and then assigned to their analysts. We got 90% at least of the classifications that we wanted to get through approved. Though some of them were approved, and this is why folks are getting individual messages on this. Some number of them were approved in some capacity other than what the application was for. For example, we had folks that were requesting a full classification study, and we were able to agree with HR that the study would be contained to an admin spec revision plus a salary review, because the member is not really arguing they should be a different classification. Just that maybe their class has changed somewhat, and as a result, the salary needs to be looked at. So those kind of things came down, and then we weren't able to batch together all of the classification studies that we were hoping, and kind of, sometimes we'd have, for example, we had a number of SSPMs that SSA put in, and our hope was to get those all batched into one study. But we were not able to get all of them batched into one study. We were able to do some batching there. So we ended up having, a little bit looser kind of slots at the end there than what we were hoping for. But yeah, if you were in that group and haven't yet gotten an email, you'll get one definitely by the end of this week, letting you know the verdict on that, as well as you'll be getting an email from HR either way. I think they were expecting to have them out this week as well, letting you know who the analyst assigned to your case is, and disposition and so forth. So as a reminder, the next window for folks to apply for this process will be, you'll likely see info come out from SEMA, January, February of the coming year. We submit to ESA in March, so we asked folks to have them to SEMA kind of around February. So we'll have a similar time frame next year. And for anyone who, heard back from SEMA that you had a strong or a good study, but that we weren't able to include you just due to size constraints this year. As a reminder, we are prioritizing folks who have submitted multiple years in a row for inclusion and who had strong cases the last time. So something to keep an eye on for the upcoming year.
And I want to highlight that's a key, that it's a strong case, right? So if the committee found, look, we're not putting your case forward because it's weak, while you're certainly welcome to reapply, if the circumstances haven't changed, it's unlikely that it would again prevail. We certainly might put it in if it's a really light year and we don't have more than 30 cases. That's hard to imagine at this point, but who knows? It could happen.
Yeah, and I think that the feedback on the language that we've got kind of from the committee on this is that based on the volume of applications we got this year, 30 probably seems like it's a reasonable number. Maybe with 40, if we can bargain this up a little bit higher in the next series of negotiations, will allow us to capture really every case of kind of medium or strong strength that came in. Maybe we'll have more interest in the process next year. But we were able to include most of I would say all of the very strong cases and most of the ones of medium strength in this year.
Great. If you're done with that, Adam, I'll skip to the AMA since it is a class-related issue.
Yeah, go for it.
So here, let me just post this in chat. So the AMA, I'm sorry. AMA is, most of you know this, but AMA is Associate Management Analyst and a Management Analyst. This also includes management aides. And I see some on the call that are in this classification. So that study goes to the Board of Supervisors during their next meeting, which is 8/17. That's their next meeting because they're on recess, which you may know right now. And the second reading is going to be on 8/31 with an implementation date of 9/6/2021. Now, I want to be clear for everyone on the call, and in fact, I'm going to put this in chat in case someone's screenshotting this. This assumes passage. Okay, this is going to the Board of Supervisors. Whenever something goes to the Board of Supervisors, it's not a guarantee, right? In the same breath, I have not experienced the Board of Supervisors to deny a classification study that's concurred with by the union. I've been working here for, not with SEMA, but in the county for 12 years. I've never seen that happen. Maybe it has and I don't know about it, but I've never experienced that. So it's extremely likely to pass. But here's something that I also want to caution everyone about. If you supervise an AMA, MA, or management aide, please relax for a little bit until it is completed. So if you go to HR right now and say, hey, I want to get this done. I heard it happened, or I hear it's happening, or been concurred with by the union. As far as the county bureaucracy is concerned, ESA, this hasn't happened yet. It's concurred to by the union and has to go through the process. So if you go in and talk to the HR analyst, or you go and talk to somebody downtown at 70 West and say, when can I get this done? They're likely going to say, I don't know anything about it. Or it hasn't happened yet. It's not happening. I don't know what you're talking about. That doesn't mean that it's not in process. It means they haven't gotten the memo yet, and they shouldn't have.
And moreover, to Zeb's point that the board, normally always approves these, that's true. And they also normally never hear anything about them from, department executive leadership. So if for some reason, folks are getting kind of over their skis on this, and it causes, some executives to have concerns about, oh, wow, I didn't realize how bad this was going to impact my budget. I don't think, department XYZ can afford another $100,000 as a result of this study. We don't want the board to start hearing concerns about this when they usually never hear anything about class studies. They just go through on concurrence normally. So yeah, as Zeb was saying, please, sit tight and wait for this to be approved by the board in the two consecutive votes.
And then once it is approved, another email will come out from SEMA alerting everyone, assuming it's approved, with again those forms that we previously sent out, so you all can process them. If you supervise AMAs, MAs, or management aides, I strongly encourage you to help them move on up, especially because it's supposed to be a trainee position. If you don't, and you are one, then by all means submit those forms once it is done, so that you can move up and hopefully your boss agrees with you. If your boss doesn't and you've been in an AMA code for 2-3 more years, give me a shout or give Adam a shout, because they really should be moving you up, unless there are serious performance concerns, which there could be, right? I'm open to that possibility. There could be, but generally speaking, our management analyst group, the whole series, are super professional, and most of them should be one tick up anyway. Our AMAs should be MAs, our MAs should be seniors, and our seniors should probably be program managers or something. So just with the scope of work that they do and the vagaries of the job description, it really allows a lot of higher level work to be smushed into those codes. Okay. If there are any questions on that, oh, Adam or somebody? Oh,
no, I was just going to say our next topic is the third rep.
Yeah, third rep. Okay, so I have good news on this. At least I hope it's good news. We interviewed, and elements of the board were present for a third round of interviews, I suppose. And we ended up selecting and making an offer to somebody. That person hasn't yet accepted. They have until Friday. So we're hopeful that this individual will accept. She interviewed very well, has lots of relevant experience, will bring, I hope, a great perspective to SEMA. I'm assuming she accepts. Maybe she won't, I don't know. And it's certainly welcome for Adam and I, and hopefully welcome for everybody on the call, because then we can get back up to three staff members, and then you all will get a higher level of service than you have been experiencing. So I can only apologize to you for the slow turnaround. I'll speak for myself, the slower turnaround times on my behalf. And if there are folks in Adam's area, or if Adam wants to talk on that, that's fine. But you'll see me more back to my snappier response times that perhaps you've experienced in years past. So I'm really hopeful on that. This person also, you know what, I'm not going to say too much more about the candidate. Let's just say they bring some experience in areas that Adam and I are a little bit weaker on with regards to organizing and with regards to kind of social media campaigns. I think we're competent on those, but it's not something we spent a lot of time doing in our careers, or at least I have. Okay, so we should hear by this Friday. If that goes the way I think it is, we'll have another announcement with kind of like a brief welcome and meet, and then some timelines as to when they'll be coming online. Okay, DFCS reorg. Did you have anything on that, Adam?
No.
Oh, something that's really important. We haven't yet finalized, whoever gets this position, right? We haven't yet finalized what the new routes will be. However, for the SSA people, I don't anticipate any change in your representation. So in all likelihood, I will continue to represent SSA, hopefully to cheers, perhaps to groans, I don't know. But so I will in all likelihood continue to represent SSA. It's unclear how things will be rejiggered. I think Adam volunteered that he believes the health and hospital system should all be under one rep instead of bifurcated like we had before, where the new hospitals were with a different rep and then the VMC campus was with another one. So there will be some changes, but likely that won't affect SSA. Okay, we have the DFCS reorg conclusions. So this, I would have really liked for this whole reorg to have been done about a month ago. Some things got in the way for those that attended a meeting. The county had a little bit of trouble getting its act together. Then I was on vacation for 2 weeks. Then we came back and the county still had not finalized its list of people that would be getting the on-call pay or have staggered shifts. They've now furnished that. That's been published to everybody. I have a few individual concerns that I'm still ironing out, but I hope that we are at a point where we can conclude the meet and confer this week. I'm looking at Friday as my ultimate goal. For those that have emailed me individually, I am working on your issues and I hope to be able to close them out. If I can't, I will have an individual conversation with you to get your sign off or explain why it's not achievable. So that's kind of the state of play where we're at right now. The most recent communications from the county, as I mentioned, included the different who they would be submitting for differentials, and included the OMC position descriptions that then the office management coordinators have reviewed. Yes, Yasmina, I see you have your hand raised.
Hi, Zeb. I just wanted to confirm, I had sent you a text message with some language that I just needed added for my position that we had agreed to that wasn't included in the final draft. And so I just want to make sure you got that text message and are able to follow up on that.
I got your text message and I used I believe you sent me an email about the language as well. And I'm aware of the situation. And that's one of the things that I'm working on.
Okay, cool. Thank you, Zeb.
Am I correct that you sent me an email?
I may have sent you an email and followed up with a text message. I think I sent you one a while back. And then when I saw the final draft, I realized it still hadn't been changed. So I sent you a text.
And this concerns the scattered sites, is that correct?
Yeah, and it concerns, the scattered sites and my location.
Got it. Okay. Yep. I have that on my list here.
Okay, cool. Thanks.
Perfect. Any other comments or questions about the reorg? Nope.
Wait,
Okay.
I have a question. So,
Hey, Melissa.
hi. I was wondering if there is an updated document from since the last meet and confer, because there were certain programs and things that were not on there. I haven't seen any updated document, and as far as I'm aware, there may have still been things moving around. So do we have that, and can you send that out?
There is, and it was sent out. I can have it resent. I also just posted it in chat.
Oh, perfect.
So this is the most recent document. that has some of the, actually, I think it has most of the corrections that what Yasmina pointed out has not been implemented. But you can see this document where there are some changes highlighted. And the new document that just put in chat also reflects the VSIP add deletes that previously were not reflected.
So I'm having difficulty opening that. I'm wondering if you can send it out on email.
Sure,
not-
I
it's
can
not
have this
allowing me to
document
open that.
resent. Let me put that on my whip.
And just making sure you received my email also about equity in the number of programs for managers.
Yes.
Thank you.
Okay. Are other people having trouble downloading that document? Can you see the document but just can't download it, or you can't even see it? Anyone? Adam, can you download the document?
It downloaded for me.
Yeah, works fine for me.
Oh, it might be a user error for me, but thank you.
Okay. Well, what I will send it all out in once again.
It could also be bandwidth.
Thank you, Selena.
Because we got video going on at the same time you're trying to download. It could just be bandwidth.
Okay, great. All right. Let me see what the next item is. I think it's the real teams.
The real teams.
Okay.